So I'm probably getting ahead of myself, but I'm just thinking either like, and I mean, this is not something that I would try to pitch you on or something. I would like to get your feedback on the idea more than anything. Is
Mhm.
either like an iPad app, like instead of a clipboard, like you fill out the iPad app and then that, like you said, it pushes it to Wi-Fi to a server somewhere, or even like some
That
kind of
one.
like a wearable technology like that the patients could wear, which is Wi-Fi enabled, and that pushes their vital signs to the server itself, so that like that would, I don't know. You tell me. Like, what's your
Well,
reaction?
the first idea of the iPad or a tablet device with Wi-Fi capability sounds like a great idea.
Okay.
It sounds like it with an app on it sounds like a great idea. My only issue with the second, anything that we put on the patient is paramount in a psychiatric hospital, and with the population that tends to self-harm or might want to injure themselves, anything you put on them can be taken apart, used, misused, that kind of thing. So I'd lean more towards the first option you said.
Okay. Okay. Um, so iPad apps. You mentioned that like taking a computer into an environment where patients interact with you could be a potentially like harmful or dangerous situation if a patient gets agitated and breaks a device somehow. Would that come into play with the iPad app?
Well, if I can clarify on what you just said, or build upon it, it's not necessarily taking a computer. It's that we typically use desktop computer stations. And so if we have a permanent computer station in a patient care area and I walk away from it to talk with a patient to get what have you, then I've just left a potentially dangerous and expensive and important tool unattended. Now, if that was a portable technology, that would be different. I could take it with me, I could move it, I wouldn't necessarily have to leave it unattended.
Um, if
Mhm.
if there were an iPad app, what would be like the minimum set of features that you would expect that app to have? Like all the nice to have stuff we could leave out for now, but just like what are the deal breaker features that you would expect this to have?
Well, ability to transmit hard data like vital signs and other objective information, even the checks that we do. I mentioned the piece of paper that has every 15 minutes of the day annotated on it. Even that could be input into a tablet. Now that I think about it, and uploaded straight into the chart. There's still an element of manual entry to that, but it's manual entry into the data source, into the electronic medical record. And so the minimum set of features, I think, would definitely be any and every objective data we collect you could get. Patient location, patient vital signs, sleep times, medication management, even for the nurses, all kinds of things.
Okay.
But now when you talk about things like patient affect, you know, nursing staff to elaborate more on and use some subjective observations, then that's the kind of thing where you probably want to step off and type on a laptop or a desktop as opposed to a mobile device or a tablet.
Okay. So another question that I just sort of I thought about earlier and I'm reminded of now is why, I mean, iPads have been around for a while. Like why is the hospital, in your opinion, I mean, I know you're not the administrator or anything, but
Mhm.
I can't imagine that that there's no app that's already out there to address exactly your concerns. So why in your opinion hasn't there, why is the facility still using clipboards?
That's a great question, and I don't know. It's easy to think that app out there that does meet our needs, or if there are similar enough apps, if they're customizable enough to meet our needs. I think that would be really important because our model of care and observation isn't the same as every other hospital. Hospitals aren't as uniform as other hospitals, like medical hospitals, in terms of rounds and things like that. And so I'm not sure there is an app out there for it, to tell you the truth.
Okay. Has your facility tried to solve this problem before, like either successfully or unsuccessfully?
I remember about 4 years ago when we implemented Epic, we went from the actual giant paper charts to electronic medical records. The thing everyone focused on was, we're going to go green, we're going to go paperless, and there won't be any more paper. And when the consultants we hired came to our hospital to check it out, they were completely stumped for the safety rounds. They couldn't, they at first they said it to those clipboards and your safety, of course we're going to. And then it was ultimately decided, we don't have a solution for that right now. And so that's the one piece of paper that remained, was the safety round.
How familiar are you with practices either at other mental health facilities or other types of hospitals? Like, do you know of anybody in the medical field that like uses a mobile application of some sort to address the situation that you're describing?
I don't. I know of a couple of other psychiatric hospitals in the region of my state, and I've talked to people that work there about what they do. And they do 30-minute rounds as opposed to 15, and some of them do even less frequent rounds. Some of them document it differently when they do their safety rounds. There's just, that's why I think if there's a be customizable, because it's not, not every psychiatric hospital runs the same. It really depends on the level of acuity. If you're a low acuity psychiatric hospital, your patients may not need 15 minutes. You could check on them maybe once every hour, and that would be adequate. If you're high acuity, your patients may need to have staff with them 24 hours a day and not be able to be left alone because of how sick they are.
Okay, because there's like an immediate danger of self-harm, for instance.
Sure.
Okay.
Or harm to others.
Sure. Okay. So by like low acuity, you mean like low danger either to themselves or others. High acuity is like high danger to themselves or others. Okay.
Yes.
So you're saying that oh, by the way, you said that 4 years ago you remember something. So you've been doing this for a number of years now.
8 years.
Okay. Wow. And it almost sounded like you were saying that like other facilities, in order to get around what's starting to sound like a bottleneck, they will actually decrease the number of rounds that they perform, like from 15 minutes to 30 minutes, like every 15 to every 30 minutes, in order to reduce the paper jam.
That may be one of the benefits, either intended or as a side effect, that it reduces the paper jam. It may also just be that they only accept a lower acuity of patient, or they just have a different philosophy about patient care. Okay. But it would be the bottleneck of paperwork.